There is a way of walking that millions of seniors over 65 have gradually adopted without realizing it. And orthopedic doctors and neurologists are now saying it is one of the single biggest predictors of a catastrophic fall. It is not about how much you walk or how far you walk. It is about how you walk. And if you do not correct it now, doctors say the consequences could change your life permanently. Let me ask you something. Have you noticed that your steps have gotten shorter over the years? That you shuffle a little more than you used to? That you look down at the ground when you walk instead of ahead? Maybe your arms do not swing as much as they once did. Maybe you feel a little unsteady when you turn a corner or step off a curb. These changes happen so gradually that most people never notice them. They creep in over months and years, and because there is no single moment when everything changes, you just adapt. You accept the new way of walking as your normal. But here is what doctors want every senior to understand. Those subtle changes in your walking pattern are not just cosmetic differences. They are early warning signs that the systems responsible for balance, coordination, and mobility are beginning to decline. And each one of them increases your risk of falling in ways that are measurable and significant. A fall after 65 is not like a fall at 30. At 30, you get up, dust yourself off, and keep going. After 65, a fall can mean a broken hip, a head injury, months of recovery, loss of independence, and in far too many cases, it marks the beginning of a rapid decline in overall health. My name is Dr. Michael Williams, and fall prevention in seniors is something I am deeply passionate about because I have seen how devastating falls can be and how preventable they are. The statistics are staggering. 1 in 4 adults over 65 falls each year. Falls are the leading cause of injury-related death in people over 65. And 95% of hip fractures are caused by falling. But here is the part that gives me hope. Research consistently shows that the majority of falls in seniors are preventable when people understand the risk factors and take action to address them. In this video, I am going to reveal the 7 walking mistakes that doctors say dramatically increase fall risk in seniors. I am going to explain what is happening in your body that causes these patterns to develop, and I'm going to give you specific doctor-approved techniques to correct each one. The 5th mistake on this list is something that almost every senior does, and correcting it alone can reduce fall risk by nearly 50%. So please stay with me through the entire video because this information could keep you on your feet and out of the hospital. Let us start with the first walking mistake, and it is the one that sets the stage for almost every other problem on this list. It is taking short, shuffling steps. When you watch a young person walk, their stride is long, confident, and purposeful. Their heel strikes the ground first, rolls through the midfoot, and pushes off from the toes. This heel-to-toe pattern creates a stable, efficient gait that maximizes balance with every step. But as we age, many people gradually begin to shorten their stride. Instead of reaching forward with each step, they begin to place their feet closer together, barely lifting them off the ground. This shuffling pattern is dangerous for several reasons. First, short steps mean your feet spend less time firmly planted on the ground, which reduces your base of support and makes you less stable. Second, when you shuffle, the front of your foot barely clears the ground, which means even a small obstacle, a raised edge on a sidewalk, a wrinkle in a rug, a slightly uneven surface can catch your toe and send you tumbling. Third, shuffling reduces the momentum that helps propel you forward smoothly, which means you are working harder with each step while actually being less stable. The correction requires conscious practice. When you walk, focus on reaching forward with each step, placing your heel down first and pushing off through your toes. Think about making your steps slightly longer than feels natural. You do not need to take giant strides. Just lengthening your step by 2 to 3 inches can make a meaningful difference in stability. Practice this deliberately for 10 minutes each day, and over time, the longer, more stable stride pattern will begin to feel natural again. But the shuffling is only the beginning, because the second mistake compounds the instability in a way that most people never consider. It is not swinging your arms when you walk. Watch a young person walking briskly and you will notice that their arms swing naturally in opposition to their legs. When the right leg steps forward, the left arm swings forward and vice versa. This is not just a cosmetic movement, it is a critical component of balance and stability. Your arm swing creates a counterbalancing force that helps keep your body centered over your feet. It contributes to the rotational momentum that makes walking efficient and smooth, and it helps your brain coordinate the complex sequence of muscle activations that keep you upright. Many seniors gradually stop swinging their arms when they walk. Some keep their hands in their pockets. Some clasp their hands together in front of or behind their body. Some simply let their arms hang motionless at their sides. Whatever the reason, the loss of arm swing removes a vital balancing mechanism and makes falls significantly more likely. The correction is simple but requires attention. When you walk, let your arms hang naturally at your sides and allow them to swing gently in rhythm with your steps. You do not need to exaggerate the movement. Just let them move freely. If you have been holding your arm still for years, it may feel awkward at first, but your body will quickly remember the pattern, and you will notice an immediate improvement in how stable you feel. The third mistake is one that has become epidemic among seniors, and it is directly related to fear. It is looking down at the ground while walking. Many seniors develop the habit of watching their feet as they walk, often because they are afraid of tripping over something. The logic seems sound. If you watch where you are stepping, you will avoid obstacles. But the reality is exactly the opposite. Looking down while walking actually increases your fall risk dramatically. Here is why. When you look down, your head tilts forward, which shifts your center of gravity forward and puts you in a position where you are essentially leaning into a fall before it happens. Your posture collapses, your back rounds, and your ability to react quickly to unexpected changes is severely compromised. Additionally, when you are focused on the ground directly in front of your feet, you lose awareness of obstacles that are further ahead. You cannot see the curb that is 5 steps away. You cannot see the person coming around the corner. You cannot see the wet patch on the floor until you are already stepping on it. The correction is to lift your gaze and look approximately 10 to 15 feet ahead of you while walking. This gives you enough advance notice to see and avoid obstacles while keeping your head upright and your center of gravity properly aligned. Your peripheral vision and your brain's spatial processing are remarkably good at managing the ground immediately in front of you without you needing to stare at it. Trust your brain. Look ahead. Your balance will improve immediately. The fourth walking mistake is one that affects millions of seniors who use walkers, canes, or other assistive devices. It is using your mobility aid incorrectly. Now, I want to be very clear, there is absolutely nothing wrong with using a cane or walker. These devices can be incredibly effective at reducing fall risk and maintaining independence, but only if they are used correctly. And unfortunately, a shocking number of seniors are using their devices in ways that actually increase their instability. The most common errors include using a cane that is the wrong height, which forces you into an awkward posture and shifts your center of gravity. Holding the cane on the wrong side, it should be held in the hand opposite your weak or painful leg, not the same side. Placing a walker too far ahead and then leaning forward to reach it, which puts you in a precarious position. And lifting the back legs of a standard walker too high with each step, which creates a rocking motion that reduces stability. If you use a mobility aid, I strongly recommend having a physical therapist evaluate your technique and ensure your device is properly fitted. This is a simple appointment that can make an enormous difference. Many seniors tell me they feel dramatically more confident and stable after just one session of proper instruction. And now we come to the fifth mistake, and this is the one I mentioned earlier that can reduce fall risk by nearly 50% when corrected. It is walking without adequate lower body strength. This might not sound like a walking mistake in the traditional sense, but it is the root cause of almost every other problem on this list. The reason seniors shuffle, lose their arm swing, look at the ground, and feel unsteady is often because the muscles that control walking have weakened to a point where they can no longer perform their job effectively. Your quadriceps, the muscles in the front of your thighs, are responsible for controlling your knee and absorbing impact with every step. Your glutes, the muscles in your buttocks, stabilize your pelvis and keep you from tilting or swaying. Your calf muscles push you forward with each step and help you maintain balance when standing. And your core muscles, including your abdominals and lower back, keep your torso upright and stable over your legs. When any of these muscle groups weaken, your walking pattern compensates in ways that increase fall risk. The remarkable news is that muscle strength can be improved at any age. Studies have shown that seniors in their 70s, 80s, and even 90s can make significant gains in strength with consistent, targeted exercise. Simple exercises like chair squats, standing calf raises, side leg lifts, and gentle lunges, done 3 to 4 times per week, can transform your walking stability within just 6 to 8 weeks. You do not need a gym. You do not need expensive equipment. You just need consistency and the commitment to do a few minutes of strengthening exercises several times a week. Research from multiple large-scale studies has demonstrated that seniors who engage in regular lower body strengthening exercises reduce their fall risk by 40 to 50%. That is a staggering number, and it makes strength training one of the single most effective fall prevention strategies available. The sixth walking mistake is one that becomes particularly dangerous in certain environments. It is walking too quickly through transitions. Transitions are moments when you change direction, change surfaces, or change levels, such as turning a corner. Stepping from carpet onto a hard floor, going from indoors to outdoors, or stepping on or off a curb. These transitions require your brain to rapidly recalibrate your balance, adjust your muscle activation patterns, and sometimes change your foot placement, all within a fraction of a second. For seniors whose reaction times and balance reflexes are slower, rushing through transitions is a recipe for disaster. Many falls happen at exactly these moments when someone turns quickly in a hallway, steps hastily off a curb, or walks briskly from a carpeted room onto a slick tile floor. The solution is to slow down during transitions. Pause briefly before turning a corner. Look at the surface you are about to step onto. Take smaller, more deliberate steps when changing direction or elevation. This conscious slowing during high-risk moments costs you only a few seconds but can prevent falls that cost you months of recovery. The seventh and final walking mistake is one that affects how your brain processes balance information. It is walking while distracted. In today's world, even seniors are often multitasking while walking. You might be talking on the phone, reading a text message, having an animated conversation with a companion, carrying grocery bags, or simply lost in thought about your to-do list. Each of these distractions diverts cognitive resources away from the complex task of maintaining balance and coordinating movement. Research has shown that when seniors are given a secondary task to perform while walking, such as counting backward or carrying on a conversation, their gait becomes less stable, their step length decreases, and their fall risk increases significantly. This is because walking, which seems automatic, actually requires significant cognitive processing, especially in seniors whose balance systems are already working harder to compensate for age-related changes. When you divide that cognitive processing between walking and something else, the walking suffers. The lesson is simple. When you are walking, especially in unfamiliar environments, on uneven surfaces, or in areas where obstacles might be present, give your full attention to the task of walking. Put away your phone. Pause the conversation. Focus on where you are going, how you are stepping, and what is ahead of you. There will be time for talking and texting when you are safely seated. Now, let me share a few additional tips that can further reduce your fall risk in daily life. At home, remove throw rugs or secure them with non-slip backing. Ensure hallways and stairways are well lit, and consider nightlights for bathroom trips. Install grab bars in the bathroom near the toilet and in the shower. Wear shoes with non-slip soles, even indoors, and avoid walking in socks or slippers on hard floors. Keep frequently used items at waist level so you do not need to reach overhead or bend down. And make sure electrical cords are out of walkways. Outside your home, be extra cautious on wet, icy, or uneven surfaces. Use handrails whenever they are available. Avoid rushing to cross streets or catch buses. And if you feel unsteady, do not hesitate to ask for assistance. There is no weakness in being careful. There is only wisdom. Let me recap the 7 walking mistakes we covered today. First, taking short, shuffling steps instead of heel-to-toe strides. Second, not swinging your arms while walking. Third, looking down at the ground instead of ahead. Fourth, using mobility aids incorrectly. Fifth, walking without adequate lower body strength, which is the single most impactful factor. Sixth, rushing through transitions and direction changes. And seventh, walking while distracted. Each of these mistakes is correctable, and correcting even a few of them can dramatically reduce your risk of a fall that could change the course of your life. I want to close with this thought. Your ability to walk safely and confidently is one of the most precious things you have. It is the foundation of your independence, your social life, your ability to enjoy the world around you. Protecting that ability is not about being fearful. It is about being smart, being strong, and being prepared. If this video was helpful, please subscribe to this channel. I share new content every week specifically designed to help seniors stay safe, active, and independent. And if you know someone who has become unsteady on their feet, please send them this video. The right information at the right time can prevent a life-changing fall. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Walk safely and take care of yourselves.